is Lydia Gowan. I'm an Arkansas State University Family Nurse Practitioner student. This is my exam video for the Musculoskeletal and Neurological exam. Here's a 360-degree scan of my room. My equipment will be there. I would perform hand hygiene and put on appropriate PPE. Hi, my name is Lydia. I'm a nurse practitioner student. I'll be doing your exam today. Please let me know if you have any pain or tenderness at any point during the exam.
Okay.
Alright, we're going to start with assessing the cranial nerves, beginning with cranial nerve 1, the olfactory. If you can cover your left nostril and close your eyes. Tell me what this scent is.
Vanilla.
Yes, and now cover your right nostril and close your eyes. Tell me what this scent is.
Cinnamon.
Perfect. Smell is intact bilaterally. For cranial nerve 2, the optic nerve, do you wear any contact glasses?
No.
Okay. Cover your left eye and read the smallest line.
LTFPH.
And now cover your right eye and read the smallest line.
LTFPH.
Perfect. Now with both eyes open, read the smallest line.
LTFPH.
Perfect. Visual acuity for OD, OS, and OU is 20/20. For cranial nerve 3, the oculomotor, cranial nerve 4, the trochlear, and cranial nerve 6, the abducens. I'm going to have you follow my finger with your eyes only and don't move your head. And now follow my finger with your eyes only while I move it to your nose. Okay? Extraocular eye movements are symmetrical in all 6 visual fields with no nystagmus, and convergence is intact bilaterally. For cranial nerve 5, the trigeminal. Can you clench your teeth for me? Okay. The temporal and masseter muscles contract with a 5 out of 5 strength and symmetric strength bilaterally. For cranial nerve 7, the facial nerve, can you raise your eyebrows? All right, now close your eyes and don't let me open them. All right, and now just let me see your teeth and smile and puff out your cheeks. Okay. Facial movements and strength are symmetric and strong bilaterally. For cranial nerve 8, the vestibulocochlear or the auditory, we're going to do a whisper test. If you can turn for me, cover your left ear and repeat these 3 words.
Football, hot dog, baseball.
Perfect. Now cover your right ear and repeat the 3 words.
Football, hot dog, baseball.
Okay, perfect. Hearing is intact bilaterally. For cranial nerve 9, the glossopharyngeal, and cranial nerve 10, the vagus. I'm going to have you open your mouth, stick out your tongue, and say ah. Okay. The uvula is midline, the palate rises, and the pharyngeal movements are symmetrical. For the vagus nerve testing, this will just be verbalized, but I would inform the patient beforehand, and then I would lightly palpate the posterior pharynx with the tongue blade to assess the gag reflex. Cranial nerve 11, the spinal accessory. I'm going to push on your shoulders. I want you to shrug for me. Perfect. Shoulder strength is strong and symmetrical bilaterally with 5 out of 5 strength. For cranial nerve 12, the hypoglossal, I have been inspecting the patient's speech and tongue movements during this exam for any symmetry and fasciculations. Can you stick your tongue out? And now move side to side. All right, and now I want you to poke your cheeks with your tongue. And on the other side. Perfect. The tongue protrudes midline and has symmetrical movements side to side and symmetrical strength. And the speech is clear with no fasciculations. Now we are going to move on to the muscular exam. If you can turn for me. I am inspecting the upper back musculature and the shoulder height and palpating the upper back muscles and the spine. Is anything tender?
No.
Okay, everything is symmetrical and non-tender with no spasms. The head is midline, posture is upright with no spasms or abnormal positioning. The cervical and lumbar lordosis and thoracic kyphosis are within expected limits. All right, can I get you to stand now? All right. Now we are going to inspect the shoulders and the iliac crest. Can I get you to bend for me? All right. So inspecting C7 through the gluteal cleft for alignment of the shoulders and iliac crest at both positions. The spine is aligned and straight with no scoliosis, and the shoulders and iliac crest remaining level at each position. I am now palpating the spinous processes for any tenderness or step-offs, palpating the cervical facets for any tenderness, palpating the paravertebral muscles for any spasms or tenderness, and then palpating bilaterally the sacroiliac joints for any tenderness. Was anything tender that I was touching?
No.
Okay, they are all aligned, symmetrical, and non-tender with no spasms. Now while you're standing, if you can turn and face me, we're going to do the range of motions. Starting with cervical, we have flexion, extension, rotation, and lateral bending. And now for trunk, we have flexion, extension, rotation, and lateral bending. Okay, was anything painful with those movements?
No.
Okay, so all cervical, thoracic, and lumbar range of motion is smooth, symmetric, pain-free, and smooth, symmetric, and pain-free. Now I'm going to inspect the shoulders, elbows, wrists, hands, hips, knees, ankles, and feet bilaterally, inspecting for any contours, deformities, swelling, symmetry, and positions. And now I'm palpating the muscles, ligaments, and tendons, and bony landmarks for any bogginess, bony enlargement, swelling, symmetry, and tenderness. And perform hand hygiene. Was anything tender that I was touching?
No.
Okay. So bilaterally, all extremities are non-tender with no abnormal findings. Now, while you're standing, I'm going to observe your gait. If I can get you to walk for me, just walk normally here and back. And now walk heel to toe. And now walk on your tiptoes here and back. And now walk on your heels. Okay, perfect. The gait is coordinated with smooth strides and arm movements, symmetric arm movements. Coordination is intact with an upright posture, no abnormal movements. I'm now going to inspect the face and outstretched arms. There are no tics, tremors, or fasciculations. Okay, you can put your arms down. The movements at rest and the body symmetry at rest and during movement is symmetrical. Now, looking at the shoulders, hands, and thighs, there's no extra movements or atrophy present, and muscle bulking is symmetrical bilaterally. Now we are going to do the upper extremity range of motion. If you can follow my movements, we're going to do shoulder flexion, extension, and then abduction, adduction, internal rotation, and then external rotation. All right, now for the elbows, we're going to do shoulder flexion and extension, pronation, supination, and now for the hands, we are going to do, for the wrists, sorry, we're going to do flexion, extension, and then radial and ulnar deviation. For the fingers, we'll do abduction, adduction, and now for the thumbs, we will do abduction, adduction, thumb opposition, thumb flexion, and then thumb extension. Was anything painful with those movements?
No.
Okay, so all upper extremity movements are symmetric, full, and smooth, with no pain. Now we are going to test the strengths. If I can get you to sit up here for me. Well, before we do the strength, we're going to test your coordination. If you can do this. Okay, and now tap on my hands. Okay, perform hand hygiene. Upper and lower extremity coordination is brisk and symmetric and coordinated bilaterally. Now we're going to do the strengths. If you can have your arms like this. Now we will test the flexion, pull to you, extension, push away, and now do this. We'll do flexion and extension, push down. Alright, so now squeeze my fingers. Alright, now do this. Don't let me squeeze for finger abduction. Now do this. Thumb opposition. Alright, so all upper extremity strength is 5 out of 5 and symmetrical bilaterally. Now for the lower extremities, starting with the hips, we will do hip flexion, pull up, and now pull down, and that was flexion and extension, and now abduction, pull together, abduction, pull apart. Okay, now for the knees, flexion, pull to you, extension, push away. All right, and now press it on the gas pedal and raise your feet up for ankle flexion and dorsiflexion. Performing hand hygiene. All lower extremity strength is 5 out of 5, full, smooth, and symmetrical bilaterally. Now we're going to do sensation testing. If you can have your arms out like this, and let me know if it's sharp, this is what sharp feels like, and soft, and then also tell me left or right. You can close your eyes for me.
Sharp left. Soft left. Sharp right. Soft right.
Okay. Sensations of the upper extremities and pain sensations of the upper extremities is intact bilaterally. We're now going to test the reflexes, starting with the left tricep, and then left biceps, left brachioradialis, now the right tricep, and then put your arm down, right biceps, right brachioradialis, left patellar, right patellar, and then the left Achilles, right Achilles, and then left plantar response medially to out, and then right plantar response medially to out. I perform hand hygiene. So bilaterally, the triceps, biceps, brachioradialis, patellar, and Achilles reflexes are 2+ and symmetric bilaterally, and then the bilateral plantar responses are flexor. That concludes my video. I perform hand hygiene, and thank you so much for your time.